Question 1. A client is receiving NPH insulin 20 units subcut 7 o'clock am daily. At 3 p.m. how would the nurse find if the client were having a hypoglycemic reaction? A. Feel the client and bed for dampness. B. Observe client gush mouth respirations. C. Smell client's breathe for acetone odor. D. Check client's pupils for dilation. Correct answer, A. Question 2. Postoperative thyroidectomy nursing care includes which measures? A. Have the client speak every 5 to 10 minutes if hoarseness is present. B. Provide a low calcium diet to prevent hypercalcemia. C. Check the dressing all the back of the neck for bleeding. D. Apply a soft cervical collar to restrict neck movement. Correct answer, C. Question 3. What would the nurse note as typical findings on the assessment of a client with acute pancreatitis? A. Steatorrhea, abdominal pain, fever. B. Fever, hypoglycemia, DHN. C. Melena, persistent vomiting, hyperactive bowel sounds. D. Hypoactive bowel sounds, decreased amylase and lipase levels. Correct answer, A. Question 4. A client is found to be comatose and hypoglycemic with a blood sugar level 50 mg/dl. What nursing action is implemented first? A. Infuse 1000 milliliters of D5W over a 12-hour period. B. Administer 50% glucose 4. C. Check the client's urine for the presence of sugar and acetone. D. Encourage the client to drink orange juice with added sugar. Correct answer, B. Question 5. Which medication will the nurse have available for the emergency treatment of tetany in the client who has had a thyroidectomy? A. Calcium chloride. B. Potassium chloride. C. Magnesium sulfate. D. Sodium bicarbonate. Correct answer, A. Question 6. What is the primary action of insulin in the body? A. Enhances the transport of glucose across cell walls. B. Aids in the process of gluconeogenesis. C. Stimulates the pancreatic beta cells. D. Decreases the intestinal absorption of glucose. Correct answer, A. Question 7. What will the nurse teach the diabetic client regarding exercise in his/her treatment program? A. During exercise the body will use carbohydrates for energy production, which in turn will decrease the need for insulin. B. With an increase in activity the body will utilize more carbohydrates, therefore more insulin will be required. C. The increase in activity results in an increase in the utilization of insulin, therefore the client should decrease his/her carbohydrate intake. D. Exercise will improve pancreatic circulation and stimulate the islet of Langerhans to increase the production of intrinsic insulin. Correct answer, A. Question 8. The nurse is caring for a client who has exophthalmos associated with her thyroid disease. What is the cause of exophthalmos? A. Fluid edema in the retroorbital tissues which force the eyes to protrude. B. Impaired vision, which causes the client to squint in order to see. C. Increased eye lubrication, which makes the client blink less. D. Decrease in extraocular eye movements, which results in the thyroid stare. Correct answer, A. Question 9. What is characteristic symptom of hypoglycemia that should alert nurse to an early insulin reaction? A. Diaphoresis. B. Drowsiness. C. Severe thirst. D. Coma. Correct answer, A. Question 10. A client is scheduled for routine glycosylated hemoglobin, A1C, test. What is important for the nurse to tell the client before this test? A. Drink only water after midnight and come to the clinic early in the morning. B. Eat a normal breakfast and be at the clinic 2 hours because of the multiple blood draws. C. Expect to be at the clinic for several hours because of the multiple blood draws. D. Come to the clinic at the earliest convenience to have blood drawn. Correct answer, D. Question 11. A client has been inhalation vasopressin therapy. What will the nurse evaluate to determine the therapeutic response to this medication? A. Urine-specific gravity. B. Blood glucose. C. Vital signs. D. Oxygen saturation levels. Correct answer, A. Question 12. A client with diagnosis of type 2 diabetes has been ordered a course of prednisone for her severe arthritic pain. An expected change that requires close monitoring by the nurse is A. Increased blood glucose level. B. Increased platelet aggregation. C. Increased creatinine clearance. D. Increased ketone level in urine. Correct answer, A. Question 13. The nurse performing an assessment on a client who has been receiving long-term steroid therapy would expect to find A. Jaundice. B. Flank pain. C. Bulging eyes. D. Central obesity. Correct answer, D. Question 14. A diabetic client receives a combination of regular and NPH insulin at 0700 hours. The nurse teaches the client to be alert for signs of hypoglycemia at A. 1200 and 1300 hours. B. 1100 and 1700 hours. C. 1000 and 2200 hours. D. 0800 and 1100 hours. Correct answer, B. Question 15. It is important for the nurse to teach the client that metformin, Glucophage, A. may cause nocturia. B. should be taken at night. C. should be taken with meals. D. May increase the effects of aspirin. Correct answer, C. Question 16. A nurse assessing a client with SIADH would expect to find laboratory values of A. Serum Na equals 150 mg, L and low urine osmolality. B. Serum K equals 5 mg, L and low serum osmolality. C. Serum Na equals 120 mg, L and low serum osmolality. D. Serum K equals 3 mg, L and high serum osmolality. Correct answer, C. Question 17. A priority nursing diagnosis for a client admitted to the hospital with a diagnosis of diabetes insipidus is A. Sleep pattern deprivation related nocturia. B. Activity intolerance T muscle weakness C. Fluid volume excess T intake greater than output. D. Risk for impaired skin integrity T generalized edema. Correct answer, B. Question 18. A client admitted with a pheochromocytoma returns from the operating room after adrenalectomy. The nurse should carefully assess this client for A. Hypokalemia. B. Hypoglycemia. C. Marked NAD and water intake. D. Marked fluctuations in BP. Correct answer, D. Question 19. When caring for client in thyroid crisis, the nurse would question an order for A. For fluid. B. Propranolol, Inderal. C. Propylthiouracil. D. A hypothermia blanket. Correct answer, D. Question 20. A client is prescribed levothyroxine, Synthroid, daily. The most important instruction to give the client for administration of this drug is A. Taper dose and discontinue if mental and emotional status is stabilize. B. Take it at bedtime to avoid the side effects of nausea and flatus. C. Call the MD immediately at the onset of palpitations or nervousness. D. Decrease intake of juices and fruits with high potassium and calcium contents. Correct answer, C.